The following is a presentation on nasal and throat swab collection for testing for respiratory viruses such as SARS coronavirus, influenza viruses, etc. Ensure that you have all the required materials, including PPE, before sample collection. The materials may include soap and water or alcohol-based sanitizer, appropriate mask or respirator, disposable gloves and gowns or laboratory coat. For eye protection, you may use face shield or goggles. Keep waste bags for discarding contaminated biowaste. Marker pens for labeling and tissue. For sample collection, keep appropriate swabs and a cool box for holding the sample after collection. Arrange all the material prior to sample collection. Make sure you have the correct type of swab, that is, only Dacron or rayon swabs with plastic shafts or flocked swabs should be used. Do not use cotton or calcium alginate swabs or swabs with wooden sticks, as they may contain substances that could potentially inactivate or inhibit some viruses or adversely affect some molecular tests. If the patient is symptomatic, they should be given a mask to wear and alcohol-based sanitizer to disinfect his or her hands. You need to explain to the patient that if they are going to sneeze or cough, they need to turn away and cover their nose with tissue paper and dispose them in the biowaste bag. It is also important to explain to them that touch is one of the major ways of transmitting pathogens, especially viruses, to others. So if they are going to cough or sneeze into their hands become infectious. So if they touch a surface, the surface can then transmit the virus to someone else. Finally, explain to the patient what you are going to do. You may also tell them during the procedure they might experience slight discomfort. Remove the VTM vial from the cool box, maintaining 2 to 8 degrees centigrade. Label the VTM vial with date and patient ID and any other information as may be required. Wash your hands thoroughly with soap and water or alcohol-based hand sanitizer prior to sample collection. It is important to always wear appropriate PPE while collecting clinical specimens. The recommended order of donning, that is, wearing of PPE, is hand hygiene, followed by gown or lab coat, then surgical mask or respirator, followed by goggles or face shield, and finally wear the gloves. Position the patient in a comfortable posture, if possible with head against a wall so that he or she does not move the head during the sample collection procedure. Remove the swab from the package and insert it into the posterior pharynx and tonsillar areas. Rub swab vigorously over both tonsils and posterior pharynx. Make sure that swab head does not touch the tongue, teeth, gums, and come in contact with saliva. Place swab immediately into the VTM and cut the swab applicator stick below the level of neck of the VTM vial to ensure proper tightening of the cap. For nasal swab, remove a fresh swab and insert it to the nostril 1 to 2 cm parallel to the palate. Leave the swab in place for few seconds and then withdraw it slowly in a firmly rotating motion. Swabbing should be then done for the second nostril with the same swab. Place the swab immediately into the VTM already containing the throat swab and break off the applicator stick as done earlier. The VTM vial is then placed in the cool box. When collection is complete, dispose of all the PPE and all contaminated materials in the biosafety bag. The order of doffing or removal of PPE at the end of sample collection involves first removing the gloves, then goggles or face shield, followed by gown, and finally the mask. Wash the hands thoroughly with soap and water or alcohol-based sanitizer. At the end of sample collection, the sample containing box is properly sealed